across the United States. Nearly 40 million children and adults live in communities where a healthy diet is out of reach. Research has shown that our zip codes can have an impact on the number of years in our lives. In many of the nation's largest cities and in a number of rural communities as well, people may live at least 20 fewer years than those in other neighborhoods. Not everyone has the same opportunities to be healthy. Improving health and longevity starts with ensuring access to healthy food, safe places to be physically active, and information to make healthy choices. SNAP-Ed plays a key role in improving these statistics because lack of healthy food access and nutrition education are major contributors, and because life expectancy estimates vary greatly from block to block. SNAP-Ed providers across the country focus on providing nutrition education for children and adults, advocating for policies that counteract obesity and other diet-related diseases, and improving systems that contribute to healthier environments. Among SNAP-Ed providers, the 19 higher education institutions across the country designated as 1890 historical Black colleges and universities are particularly well positioned to serve these needs. 1890s plays a crucial role in supporting historically excluded individuals, those most impacted by obesity and other diet-related diseases. While all 1890s are eligible to receive SNAP-Ed funding, only 9 currently do, with 2 recently receiving funding in fiscal year 2022. The Food Trust investigated the barriers and opportunities to accessing and administering SNAP-Ed resources by conducting an environmental scan of the 1890s and 1862 land-grant institutions and state SNAP-Ed agencies in the 18 states where 1890s are located, conducting interviews with administrators, staff, participants, and community partners in collaboration with 3 1890s, reviewing findings and discussing the future direction of the investigation with the 3 1890s, convening 1890s to share key findings and develop a set of recommendations, developing a plan of action to work towards implementation of recommendations. The study found the following. 1890s have a proven record of success in reaching and effectively improving the health behaviors of individuals and environmental supports in the communities they serve. Among the 1890s that do receive SNAP-Ed funding, many receive smaller grants than the 1862s and other SNAP-Ed implementing agencies. Some states do not have an open application process for applying for SNAP-Ed. Agreements with SNAP-Ed state agencies and 1862s may limit geographical reach for 1890s in some states. Some states do not receive 100% of the required state match for federal land grant funding. Through leveraging SNAP-Ed dollars and reducing funding disparities, 1890s will be able to better reach and serve under-resourced communities and improve the health of SNAP-eligible individuals. Funded through the Supplemental Nutrition Assistance Program, SNAP-Ed makes the healthy choice the easier choice in under-resourced settings through education, social marketing, and change in policy systems and environmental conditions that support healthy eating and physical activity. SNAP-Ed supports SNAP's role in addressing food insecurity and is central to SNAP's efforts to improve nutritional and prevent or reduce diet-related chronic disease and obesity among SNAP recipients. SNAP-Ed programming takes place in an estimated 80,000 low-resource locations with more than 87 million people who are income eligible. SNAP-Ed programs run in all 50 states, the District of Columbia, and the Territory of Guam. Through a community-based approach to nutrition education and promoting physical activity, the implementation of SNAP-Ed is uniquely tailored to the needs of rural small town and urban communities, as well as a range of diverse populations, from children to seniors, and ethnicities. SNAP-Ed programs are evidence-based and delivered in a variety of locations, including schools, food pantries, grocery stores, and faith-based institutions. SNAP Ed funding allocations are based on state shares of both SNAP Ed expenditures and SNAP participation. Prior to 2009, half of SNAP Ed funds come from program administrative funds and half come from state and local match contributions. The earlier match requirement limited the opportunity for institutions and groups, including the 1890s, to receive SNAP Ed funding. If they did not have the required state and local match available at the time, they were ineligible to apply for funding. While there is no current match requirement, the earlier requirement limited the ability of many 1890s and other groups to receive funds. The lasting impact of this earlier requirement has been compounded since over time, SNAP Ed funding was allocated to other universities and agencies, often limiting available funds for the 1890s. At the current time, funding is allocated based on a formula, 50% based on the state's fiscal year 2009 SNAP Ed expenditures and 50% based on the state's share of national SNAP participants from the previous 12 months. SNAP Ed has not received a substantial increase in funding for the past decade. Within states, funds are allocated by the state agency. Most states do not have specifications for how the funds are distributed. Applications for funding are state-specific. Since 2009, SNAP Ed grants required no state contribution or match to receive SNAP Ed funding.
Many times in our state legislative bodies, schools have been made to be different because of money going more toward one than the other.
I made that impact for them to talk about that recipe that we made with the vegetables that they had never tasted, and they're like, bring that lady back.
Once they're able to see those connections related to health and apply some of the tips and tools that we teach them, they can begin to live a more prosperous life, and they see that impact throughout the generations.